Hello everyone, this is Jin, a TCM practitioner and instructor in Victoria, BC, Canada. Here is my online class for acupuncture case study. The book we use I put below. I hope I can help the students study and review for the class. Okay, let's start. Okay, let's discuss together. Unit's name. Yeah, headache. The pattern. Yeah, what's the pattern? Yeah, passenger code. Thermal pattern. Yeah, wind code blocking the channel. That's basically this passenger code. Similar there. Yeah, pretty similar there. Yeah, wind code invading Yangming channel. Yeah, wind code blocking channel. Malay is I would like to say that's generally Yang deficiency. We are not say channel deficiency. Yeah. So wind code blocking the channel, thus many things cause the headache. Another situation for patient is generally Yang deficiency. I think they have typically symptoms. They talking about in the summertime. There it is. Okay, let's go over the symptoms here. Recurrently, forehead pain. Forehead that we talking about is the Yang channel there. It's 10 years. Yeah, it's 10 years. Pain gradually getting worse, yeah, more worse. When the headache began, there is no obvious cause. In the last year, headache is more frequently and more severe. The other symptoms in head region are dizziness, feel cold, yeah, feel cold. That's certainly some Malay cold in there. And patient always wear a hat, even during the summer, sensitive to cold. So here, that's generally some young degree sense. It's not only channels things. Yeah. So if a patient always put a hat in the head and put more clothes in the summertime, that's generally young difference.
And the sticky white discharging from the nose and nose blocking. It diagnosis with chronic sinusitis. Still cold blocking there. Still cold blocking there. But there is a tablet from the pen. The focal headache still in there. No changing. After patient have bad headache caused insomnia. So this kind of insomnia is caused by painful situation. It's not like usually we talk about heart issue. And losing appetite for the past few days. That's still relationship with people have painful situation. No dessert to drink. No dessert to drink. So we're talking about the urine is not heat set in there. Yeah. If patient like some heat inside, they thirsty and they try to drink cold water. Urination is normal. Passing too loose and formed stool. That's some cold signs also. Yeah, that's some cold signs. And slightly pale, face slightly pale. Tongue body is normal. Yeah, even they talk about slightly red body, but this is normal. Tongue coating is white. Sunken pulse. It can be coming from internal issue, can be coming from like a kind of dampness blocking. Yeah. Forceless lies usually is decreasing kind of pulse. And certainly can coming from something blocking, usually it's dampness blocking. So basically, for this case, we see a lot of cold signs. We didn't see like so much dampness signs. And we also see some different signs. So that's basically channel thing is kind of in cold blocking, especially the channel. But the underlying body condition have some young difference in it. They didn't talk about special organ, so we just say generally young difference, but not especially go to like a kin young difference or maybe spring young difference. But if without treatment, maybe later on some more symptoms show up, go to special organs. So people 29, not too old, yeah, not too old, but not too young, yeah, not too young, but still should be young, strong in there. But the size is kind of young size in there already. Let's see. It's not a big difference between code blocking the channel and the code blocking the channel. So basically, code itself is not like easily evading people. They always with wind, but just sometimes maybe big wind, small cold. Sometimes it's small wind, big cold. So for this patient, it's kind of a small wind and big cold. So wind always bring other passengers evading. So cold itself is not that easily to come in. So we still say wind cold blocking. Yeah, still good. Yeah, still good. Yeah, that's like we talking about wind is moving. Easy coming, easy go. Yeah, easy coming, easy go. I believe this patient originally some wind cold evading, and later on the wind is gone, but keep the cold blocking the channel there. But originally it's been cold emitted. Yeah, right now the situation we can say cold blocking. Yes.
Jen, I have a question.
Yeah.
So for excessive cold, like
Yeah.
I guess just because it was like 10 years duration, I kind of thought that was like more a deficient sign, but you can have excessive cold for 10 years.
So we're talking about excessive cold blocking the channel there, and also pay attention recurrently. It's not like 10 years continually in there. Yeah, sometimes for some reason and they come back, but truly something still blocking there. That's why it's 10 years. It's like gradually attacking there or blocking there. It's possible to for 10 years. Like if without treatment, some people have like a whole life originally coming from like EPI wind cold and then blocking. But like I say, the wind maybe go away, but the cold still not totally relieved, still blocking there. Sometimes maybe get a little bit more severe. People got a painful situation. Sometimes it's let be relieved. Patient feel like getting better. So that is possible, yes. Yeah, some more discuss for the pattern or the symptoms here. And the same situation happens for the patient's nose also. Yeah. So that's still originally coming from like an EPI code or wind code, but still not totally released. Yeah. It's blocked.
Jin, do you think the yang deficiency came from the yang ming channels being blocked, blocking the stomach and the large intestine meridian, creating just a general cold?
Yeah, that's true. Yeah, that's true. Yeah, for 10 years, it must be damaging some yang internally. Yeah. I don't think that this patient is like originally yang deficiency, like a long-term yang deficiency, then like caused easily EPI evasion. I believe like a chronic some cold in there, damage internally, and then cause yang deficiency. Yeah. Some more questions more discuss here. Okay, our treatment principle. Yeah, treatment principle. Yeah, disperse cold from Yangming channel, stop headache, warming yang qi. Yeah, yeah, that's good. Yeah. So that's that's I feel in the cold. Remove obstruction of the channels. channel off. And because it's stop pain, relieve headache, and tonify or warming yang. Yeah, so your points. Yeah, your points. Yeah, stomacher 43, LF4, stomacher 36, marks are there, yeah. Gallbladder 14, yes. Yeah, gallbladder 20, yes. Yeah. So in the book, they put a 四神功 on the top of the head. It's raising some yang qi and also using locally. And bladder 2, yeah, bladder 2. So right on the headache area. And gallbladder 20. With the gallbladder 20 is good choice. Relieve external wind and internal wind. And 223. 223 still kind of locally open channel there. But 223 truly have function to calming the spirit, like help people sleep. Patient because have some people in there and couldn't sleep. And gallbladder 12 still open the channel. Yeah, still open the channel. And they also use some maxa. Also use some maxa. Yeah, also use some maxa. Let's see your points here. Your points here. Yeah, stomach 44. LFO, yes. LI20, help nose, yes. And the local, yeah, stomach 8, yeah. Okay, good. Stomach 25 here, helping to losing stool. I think the patient have some losing stool there. Yes, okay. And Maxa, then 5, yes. Stomach 35. Amiens, yes. Yeah. Yeah, your voice looks good, yes. Yeah, some more discuss for this case.
Jen, there's no distal points in this treatment plan. Why do you think that?
Yeah, I think clinically, truly we can use some distals. Yeah. Yeah, in the book, they just mainly use kind of mainly local points there. But clinically, truly we can use some distal points. And certainly, like people more young deficiency, I believe if we use some 25 points, like stomach 36 or even some spin points there, even better. Yes. Yeah, some more discuss. It look like a good for this one. Okay, okay, looks good. Okay. So still no one good for your case for today, right? Yeah, just double check. If no one good for your case for today, we still go to book case. Yeah, just let me know anytime when you're ready. Let's go to another book case.
Jen, I just have a question.
Yeah.
Where would you do moxa for this case? Just on the back? Like do 20 or something?
So we do moxa in the book. Yeah, in the book they didn't talk about like which one is special moxa. But truly for us, I still prefer some different points. But in the book, I think they do 20 there.
Yeah, because it just says for both prescriptions, moxa is applied for 30 minutes after needling.
Yeah, they didn't specially talking about the points there. Yeah. Yeah, but yeah, I think they do 20 there maybe. They didn't put other points there.
Mm-hmm. So you would also maybe do distally, you think? But
Yeah,
just
I think
one
yeah, I think we can do distally. Yeah. And if you like to the head area, we can do some indirectly, like we talked about before, not directly, especially for some people have some hair in there. If you directly you burn the hair, so indirectly you can do 20, or maybe like a channel around the channel there, like a stomach ache, something around that area. We still can do indirectly. And I prefer myself, I prefer this one.
Okay, thanks.
Yeah. Yeah, anytime have any questions, just let me know.